Well, hello, everyone. This is Dr. Ami, your friendly rheumatologist, and I have a guest today. Look at this furry ball. My cat doesn't want to leave me. Say hi. His name is MKK. That's my cat. He's here to take care of the mice situation. We have some in Denver, Colorado. Anyway, since he's here, I haven't seen a mice, so I'm good. You see a problem, you find a solution. That is my motto. And he's adorable in addition. And he purrs, and you may hear him purr, and that would be awesome, right? Because it can help us help with the healing. So anyway, today I really wanted to talk to you about inflammatory back pain because I've recently had a patient who has been having a lot of back pain for a very long time. And I thought, hey, I have talked about this, like the difference between inflammatory back pain and mechanical back pain. So please go and look at some of the videos at the beginning. But I wanted to go a little bit deeper in this. So I'm going to just example of a patient, right? So let's say a young man that's 28 years old and has had back pain, actually more like 35 years old, and has had back pain since he's 18 years old. This is a completely, like, it's not the case that I recently saw, but that's the typical case. So young man with back pain for a very long time, and the pain is worse in the morning or in the middle of the night. It's associated with morning stiffness. So you feel like you have to do this all of the time, or like in the morning, like you have to move. And then develop some pain of the periphery. So hand pain, finger pain, ankle pain, feet pain, etc. And, what are the thing that is really interesting is to really first realize that in the community, we do not know about inflammatory back pain. And so, right, this person is in his 30s and he has had pain in his back since he is a teenager, right, like 18 years old. I mean, that is inappropriate. He should have seen a rheumatologist a long time ago because there's no reason to have back pain when you're young. So if you are a young person, or you have a kid that is a young person, or you know someone that's a young person and that they have back pain, I highly recommend that you get them seen, or you get yourself seen by a rheumatologist, so that we make sure you don't have an inflammatory back pain. And the reason for this is that we have very easy treatment. It doesn't necessarily mean that you're going to be on something big right away. So in fact, anti-inflammatory at first is really like, it's actually a way to diagnose an inflammatory back pain if the anti-inflammatory work. So that's like the first thing. I think that's important. And then the second thing is, and that's something that I was explaining today, and I thought, oh, I need to bring this to the Rheumatology 101 because it's so cool, right? When you have an inflammatory back pain, I'm putting a circle here. Because it's a Venn diagram. When you have a rheumatologic back pain, inflammatory back pain, we're going to look at other type of condition that's doing the Venn diagram until we find, so for us to see if you have not just the inflammatory back pain, but also possibly some other conditions that are associated with it, because we have a sort of this family tree that can basically, when you have an inflammatory back pain, you may have another of those conditions. It comes and goes as a family, right? And a clusters, even, that's a better word. So some of the things that you want to look at is, do you have any sort of eye inflammation? Because uveitis can be associated. So that's the inflammation of the eyes. Usually you don't necessarily see much, but if you look at the sun, it's painful. And then like looking, it's kind of blurry, right? So that would be like inflammation. And if your ophthalmologist says that you have inflammation, so uveitis, so inflammatory back pain, uveitis, psoriasis, so psoriasis, I cannot really say it properly, psoriasis, as well as inflammatory joint pain, periphery, so the hands, the feet, things like that. Psoriasis is in French. Psoriasis, it's written the same way. That actually can be only seen sometimes just the scalp. So like you may think that you have dandruff, but really actually it's psoriasis. You can actually have it inside the ears. And that may be the only place you have that. So it's like scaly patches of skin changes. And then you may also have it only on the nails. And so your nails are changing and you're like, what's going on with my nails? And maybe you may think that you have a fungus, but really it's just nail changes because of psoriasis. So if you have that, we really want to know. And then reactive arthritis, which is an inflammatory back pain, inflammatory joint pain after an infection. That is important as well, because that's called reactive arthritis, and that can be associated with inflammatory back pain and so on. And inflammatory bowel disease. So for example, if you have blood or diarrhea, so Crohn's, colitis, ulcerative colitis, all of those things, you wanna know about this, because that may be associated with inflammatory back pain. So this is where the art of being a rheumatologist comes in. It's really an art in the sense of you have to really know about it, and then you have to go above the knowledge. You put that together, you really ask the right question, and then you put that together, and then you can say, okay, this is what I think you have. And really what's really cool about this is that it's really more like of a diagnosis based on your symptom, based on how you present. And it's really that is the most important for us to make a diagnosis than the blood work. So of course, if you have a HLA-B27, that's going to be like, if you have the symptom plus a HLA-B27, that's pretty obvious. And then we can do an X-ray and an MRI of your sacroiliac to see if you have an inflammation of the sacroiliitis. Even if what's bothering you is higher up, that is what we're looking at, the sacroiliac, because we know from studying patients with ankylosing spondylitis, which is this inflammatory back pain associated with HLA-B27, and sometimes, some other time, you don't need that. But we know that the inflammation of your sacroiliac will always be there if, like most of the time, if you have involvement of your spine, 99% of the case, you will have involvement of your sacroiliac. So you get more bangs for your buck. I can't remember that expression. If you do the sacroiliac MRI. So that's like a really good test, okay? Once we make that diagnosis, the really cool thing is that the first line of treatment is actually an non-steroidal anti-inflammatory drug. So ibuprofen, diclofenac, Aleve. And most of the time, our patients have already tried some of those and they know that they need it, right? And so that's really, really cool when that happens, because you're like, well, do you take any anti-inflammatory? Oh, yeah. And if I don't take it, I feel horrible. I have so many more hours of morning stiffness. I feel so stiff and I can't move. And so that's really helpful. If that doesn't work and we try 3 of them, we go to a TNF inhibitor such as Humira, Enbrel, all of those, Remicade. We have so many, Cimzia, we have so many now. And that usually takes care of it, and it's really life-changing. If it's psoriatic arthritis, that we actually do a lot like this, but we may actually, because of insurance, because really studies have shown that it doesn't really help, we may have to try methotrexate or another, DMARD. But overall, what I wanted to say here is that, number one, having pain as a young person, so young is less than 50 years old, but really less than 40 years old. If you have back pain and you're less than 40 years old, you want to be evaluated by a rheumatologist. That's number one. Number two is that really once we see this, you want to make sure that you don't have any of those other symptoms that I was telling you, just to make sure that you don't have something else with it, because that's actually important. And then if it's really just inflammatory back pain, NSAIDs such as ibuprofen, diclofenac, Aleve, meloxicam is going to actually help you. And if that doesn't help, you switch to another one, and you switch to another one until you've tried 3 of them. And if that doesn't help, we talk about, some other treatment. The anti-inflammatory, the NSAID, so the ibuprofen, diclofenac, and so on, they have been proven to change, the formation of issues in the bone in the spine. And so I think that that's really cool to realize that even something as old as ibuprofen really works well, okay? And I wanted to share this so that you don't fear. Don't fear. In rheumatology, we have amazing treatment and they work really well and they are very well tolerated and we know how to use them. And so if there is one word of advice for you is be hopeful, because we have amazing treatment out there, and we know how to diagnose what's going on when it's inflammatory. So don't hesitate to come and see a rheumatologist. All right, and talking about seeing a rheumatologist, if you are in Denver, Colorado, and you're looking for a rheumatologist that really truly cares and wants you to get into remission as soon as possible, because we can, well, I urge you to consider looking at me. And I'm Dr. Isabelle Amigues. It's written Amigues, Amigues. And it's the practice is called Unabridged MD, because it's the unedited version of you and the unedited version of me. Have a wonderful day, and I look forward to seeing you. And be well. Take care. And that cat didn't move. And he purred a little bit, but you didn't hear. Take care.